who get COVID-19. And remember that cardiovascular diseases include diseases like diabetes that really does affect the cardiovascular system. So yes, patients who have cardiovascular diseases, in particular heart failure and other cardiovascular diseases, are at more risk and are more prone to acquire the virus because their immunity cannot really keep the virus at bay when it gets in, or even try and keep it so that it doesn't get into the immune system or fight it. And when they get the infection, they tend to get more severe infection. And so they fall into the group of the vulnerable group, Alan.
All right. Now, when you talk about these cardiovascular diseases, this has been established as one of the major killer diseases globally, and Kenya ranks quite high up in the charts when it comes to this. Now, one of the biggest concerns that we have as a country, and also just different regions across the world, is the detection. Some people don't have the right mechanisms to detect it, so you just find that you're living and you don't necessarily know that you have this condition. In terms of the global numbers, where are we as a country compared to other nations in terms of detection and the patients?
So it's interesting that cardiovascular diseases are very silent, and most of the time they are neglected. But to remember that cardiovascular diseases cause up to 18 million deaths globally, and then you're having more like people would assume that these deaths occur in developed countries because cardiovascular diseases are related and more people tend to associate them with developed countries. It's surprising that 80% of these deaths occur in poor and developing countries. So where Kenya falls in this case. So now looking at that amount and that disease burden, and considering that right now as a country we are moving to, besides dealing with COVID and all the infections that we have from HIV to TB, right now we are trying to focus more on non-communicable diseases, and cardiovascular diseases are causing 80% of the deaths from non-communicable diseases. I think it's a big, big issue that needs to be taken care of and addressed, and more awareness should be created for Kenyans to be able to be aware that, yes, this is a big problem, it's a silent problem, and it takes as a simple test like just having your blood pressure checked at least twice a year, having your blood sugar checked at least once a year, and everyone above the age of 30, at least making sure that they have an annual evaluation around their cardiovascular health, and having a cardiac evaluation done at least once a year to make sure that these things are picked early before the complications develop, because it's the complications that takes our patients down, Alan.
All right. Now, you've talked of a simple step, just making your way to the hospital and doing the test. But you know, one of the reasons as to why people don't necessarily go for this test is the costs incurred. Can you maybe talk on this or touch on this? What are those particular semantics that have to be looked into? What is the cost of somebody just waking up one day and telling themselves that I need to go and get my heart checked?
Okay, I appreciate the fact that there's some cardiovascular assessment tests that can be costly, but just having a blood pressure done from, let's say, in a village in Nyando, where someone can just go to a dispensary in their village and have their blood pressure checked, that should be actually free to just have your blood pressure checked. And having a sugar test checked. A sugar test, I think, in a normal health center should cost between 100 shillings and 300 shillings. And that's a test we are doing for you just once a year for adults. I think it's high time that I think culturally we need to change our approach on regards to how important we consider our health as Kenyans, so that we start giving priority to our health, because, as I said, the heart is the center of all this, and your health is of paramount importance, so that you're healthy to actually say that then I can go and fend for my family, or I can go and work, or I can go and run for political office. So we need to treat health, and our health in this case, and for this particular day, our cardiovascular health, we need to treat it with the utmost importance, and remember that our health should be and must be a pillar of our national importance, and it should be given that respect as it deserves, Alan.
All right. Now, you've talked of checking yourself, and we know very well that these cardiovascular diseases for a very long time haven't necessarily been common in young people as compared to the elderly people. Has anything changed on this front?
For sure, for sure. A lot has changed.
Yeah.
Now we are seeing, we talk about COVID pandemic, but we actually have the cardiovascular diseases becoming the new silent pandemics. And the pandemic now is moving to younger age groups because of the rise of obesity and sedentary lifestyle. And us as Africans changing our outlook on the cultural angle of success, where we think that if you're successful, then you shouldn't be exercising, you shouldn't be working. A lot has changed, where we're embracing some cultural practices that entail not really moving around a lot. But remember, looking back to our African way of life, where people used to go to the farm, and they would sweat, and that would entail actually just exercising. But we're seeing now in the major cities, our children are not moving around, they don't have any playgrounds, so we're seeing a rise in childhood obesity that is going into young adulthood and young teens having obesity and developing cardiovascular diseases, including high blood pressure and diabetes, way earlier. We are seeing people as young as 18 and 16 and 19 having diabetes and having high blood pressure. So yes, the pandemic is shifting, and there is a shift from where we used to think that diabetes and high blood pressure are diseases of the old to these cardiovascular diseases coming in way earlier than we thought. And I think it's something that should worry all of us as parents and all of us as Kenyans.
All right, very well. Now, you've talked of obesity, which is, of course, one of the leading causes of cardiovascular diseases. And a lot of times when you speak to young people, and more so people that are not naturally driven to probably go work out and be better for themselves, you find that they talk that it's a natural thing. I have the fat gene, for lack of a better word. Is there anything like somebody having a fat gene so that he can actually justify this obesity scenario?
I don't think there's justification for obesity. Obesity is not, I don't think we should look at it the way we do it. We look at it like a social stereotype, where we're just saying that if someone is fat, they're lazy or something like that. Obesity is a disease, and a disease that needs to be addressed. And if you're obese, you need to seek help and get a healthcare worker, a healthcare practitioners to see you and treat you because you're at risk of these things. I think it's just for us to change our cultural mindset from thinking that because my grandmother was big, as you said, or my mother is big, then it's okay for me to be big. It's just to remember that what does that mean to your cardiovascular health, and is there help for you? So that just the same way if you have malaria, you go and you're treated, just the same way in that regard, you should seek medical help and be seen so that your cardiovascular risk can be taken care of and you can be helped. Right now, we are seeing that Kenya is really making progress. The Kenyatta National Hospital right now is doing bariatric surgery for people at an affordable cost, and that's a procedure that can actually really help this patient that was initially not available or easily accessible for a lot of Kenyans. So it's just for us to do public sensitization and awareness that yes, all is not lost, and I don't think people should sit and say, this is my genetic makeup. And yes, there's a genetic susceptibility for someone, but there's also the lifestyle, which really contributes 70%, Alan, to what really happens to our bodies.
All right, let's now talk about pregnant women, which is also a very big concern when it comes to these particular diseases. You find that in most cases, for the pregnant women who suffer from these cardiovascular diseases, for the baby to be saved, you usually find most of the times the mom has to lose her life. Has anything changed on this front?
That's a catch-22 question you're asking me there. Yeah. But you know, me being an internal medicine consultant, normally it's a collaborative thing. We collaborate between the physician, cardiologist, and the gynecologist or the obstetrician who's taking care of the mother. So it's normally a very delicate balance where we ask the mother versus the child, and really we don't choose one over the other. We normally want to save both of them, but there are situations where we have to choose one, and normally we would choose who we have to choose depending on the health status of the individuals that are involved. So normally it's a hard call to make, and it's one of those things that really, really get to us as health practitioners, because all lives are important, Alan.
All right. Now, as time moves by, of course, it would only be right for me to ask that in different fields, like you find in the cancer field, in different medical fields, you find that as time progresses, you have new interventions that have actually helped with the scenario. When you come to cardiovascular department, is there any specific intervention that has come in the recent past that has actually aided this particular campaign?
Yes, I'd like to mention before I even say which interventions are there. I think over the years, besides, I think the past 4 years, we've been doing the May Measurement Month, and that's done in collaboration with the Kenyan Cardiac Society. We screen Kenyans for high blood pressure. We go to markets, to churches, to different, even hospitals where we can actually just do and screen and try and see the prevalence of hypertension amongst our Kenya, which currently stands at about 25% of Kenyans having high blood pressure, and another 25% out of that, up to 75% not well controlled, the ones that are already diagnosed. So there are measures that are put in place really, and it's more to establish the prevalence, because that's where as African countries, most of us we are at the prevalence stage of trying to establish disease. But yes, a lot of interventions that were there to try and treat or manage or contain these conditions that initially were not available locally, are available now locally, right from interventions when someone has a heart attack. We are seeing more cath labs being set up across the country. This is centers where, or labs where, theaters where they can open up vessels when they are closed when someone has a heart attack. We are seeing more public sensitization spearheaded by different organizations, at the topmost, the Ministry of Health and the Kenyan Cardiac Society. And we are seeing more of those available imaging modalities that were initially not available locally, being available in different hospitals, mostly across the big cities. And we'll really love this to go to the small cities and to have a good referral system where heart diseases are picked early and referred to the relevant centers where they can be managed. And still, if we could just empower all counties to be able to be cardiovascular centers of excellence, that would be really, really lovely, and it will go a long way to try and catch complications early and to manage them early, Alan.
All right, now just as we wrap up, allow me to engage you on this. Of course, yesterday the president gave out his address, and one of the biggest news that Kenyans were waiting, of course, is to resume their parting ways, for lack of a better word, and we're now going to see different people engaging in different platforms. From where you're sitting from, what are we going to see? Of course, we're expecting, there's some expectations of a second wave of infections in terms of the cardiovascular diseases. From where you're sitting from, what are we expecting in these coming days now that these restrictions have actually been eased and Kenyans are necessarily slowly getting back into normalcy?
I'd like to first mention, Alan, that today I saw one of the dailies was, the headline was, "It's time to party." And I think even as we mark this day of the World Heart Day today, we need to remind ourselves as Kenyans that just use your heart to try and combat and fight cardiovascular diseases. And that will include just being aware that excessive consumption of alcohol, excessive use of sugary and refined sugars in this case, and weight gain, which is attributed to sedentary lifestyle and too much of use of alcohol and all the other related lifestyle choices that we make, they have an impact on our cardiovascular diseases. And so let's do everything in moderation and remind ourselves that yes, COVID is still a reality. And if we start flaunting those rules that were put in place, assuming that now we feel like we are flattening the curve and things are going back to normal, we'll only just open up for a second wave of the infections, and ultimately things will be closed down again. So for us to sustain this freedom, or this new freedom that has excited a lot of Kenyans across the nation, we have to ensure that we maintain social distancing, we wash our hands, and we observe all those rules and regulations, including respiratory etiquette, that have been put into place, Alan.
All right, Yubrine, thank you very much for creating time for us here on the Daily Brief. That's all the time we had for this discussion.
Thank you so much, Alan.
All right, that was Yubrine Moraa Gashemba, who's a consultant physician at the Nairobi Hospital and also doubles up as a health advocate, just shedding more light on today's day, which is the World Heart Day, and what is expected of us. At this point, we've come to the very end of the second hour of the Daily Brief, but it's a Tuesday, so our date has not just ended yet. I'll be back with K24 Newscut in a few, so do stay with us.